Good morning, fellow classmates. My name is Nayeli Santibáñez, and this morning I will be talking to you about the importance of safe sex, hoping to persuade each and every single one of you to practice protected sex in order to avoid unwanted consequences. You may ask, why is safe sex important? Practicing safe sex is important in order to prevent us from unplanned pregnancies, HIV/AIDS, and STDs, sexually transmitted diseases. Unplanned pregnancies can lead to a heavy burden on you financially and mentally if not prepared. Every year in the United States, there are 60 million women in the childbearing years of 15 to 44. 3 million of them use no form of contraception, accounting for 47% of unplanned pregnancies. Unplanned pregnancies can then lead to a difficult decision such as abortion or adoption, which as well can ultimately cause other complications. HIV is one of the most serious deadly diseases in human history. HIV causes a condition called AIDS. The illness interferes with the immune system, making people with AIDS much more likely to get infections. 1.1 million Americans are living with HIV, including more than 468,000 with AIDS. An estimated 21% of people living with HIV are undiagnosed. Every 9.5 minutes, someone in the U.S. is infected with HIV. STDs are also referred to as sexually transmitted infections, or STIs. These diseases include genital herpes, genital warts, HIV, chlamydia, gonorrhea, syphilis, hepatitis B and C, among others. They are diseases that are spread by having sex with someone who has an STD. The estimated number of people living with STDs in the U.S. is over 65 million. Every year, there are approximately 15 million new cases of STDs. About 66% of all STDs occur in people of 25 years of age or younger. At least 1 in 4 Americans will contract sexually transmitted diseases at some point in their life. But there are many methods on how to prevent unplanned pregnancies, HIVs, or STDs. For starters, abstinence is the most effective answer to preventing any of these risks. However, abstinence is not always a practical or desirable option since it takes a strong-willed person. Next to abstinence, the less risky approach is to have a mutually monogamous sexual relationship with someone you know is free of an STD. Ideally, before having a sex with a partner, each of you should get screened for STD, especially HIV and hepatitis B, and then show the results with each other. Other methods include birth control. Today we have many safe and effective birth control methods available to us. Contraception includes barrier methods which stop the possibility of sperm and egg meeting, such as condoms or diaphragm, and hormonal contraception which suppresses ovulation. The hormones can be delivered by injection, by mouth, or placed in the vagina. Males can take spermicides or use withdrawer prior to ejaculation. They can also have a vasectomy performed or practice outer course. More commonly, you can use condoms to avoid contact with semen, vaginal fluids, or blood. Both male and female condoms dramatically reduce the chance you will get or spread an STD. However, the condoms have to be properly used. Keep in mind that STDs can still be spread even if you use a condom, because a condom does not cover surrounding skin area, but a condom definitely reduces the risk. Lubricants may help reduce the chance a condom will break. Use only water-based lubricants because oil-based or petroleum-type lubricants can cause latex to weaken and tear. In conclusion, safe sex is about taking precautions. Sexual intercourse with someone of the opposite sex could lead to an unintended pregnancy, and sexual contact of any sort could spread sexually transmitted diseases. Safe sex is absolutely essential to avoid these unwanted consequences, and it must happen before you are anywhere near ready to have sex. The good news is that we can protect ourselves from STDs. Practicing safe sex allows you to reduce your risk of getting sexually transmitted diseases, and if you've done anything that puts you at risk of an infection, getting tested allows you to get any treatments you may need. In summary, safe sex requires prior planning and good communication between partners, given that couples can enjoy the pleasure of a sexual relationship while reducing the potential risks involved. So what I ask of you is to simply be aware and prepared, because everyone is at risk. Thank you.